Hi, my name is Peter Goadsby and I'm Professor of Neurology at King's College London. I'm pleased to present to you a series of videos that raise awareness around migraine. Migraine is a common neurologic disease worldwide that is highly disabling and impacts the quality of life for people with this condition and those around them. These videos are conversations between physicians and people with migraine, where we'll hear first-hand experiences of people living with this condition and gain insights into the debilitating nature of migraine. These videos will cover migraine throughout a woman's life, stigma and attitudes towards migraine, untreated or underdiagnosed and misdiagnosed patients, migraine in the workplace, Hi, my name is Peter Goadsby and I'm a neurologist interested in headache disorders. I'm Professor at King's College London and an Emeritus Professor at the University of California, Los Angeles. Today I'm talking to Shoshana about her headaches.
Hi, my name is Shoshana Lipson. I am a patient advocate for migraine and chronic pain. I'm the president of Hope in Pain and the executive director of Migraine Meanderings.
Well, Shoshana, let's start at the beginning, so to speak. When do you think your headache problems first started?
Yes, my earliest memories are actually of having headaches or having migraine attacks, as I was told they were. We're going back at least to the age of 7 or 8, possibly even earlier than that.
And who told you that they were migraine?
So I'm not sure if my parents took me to a doctor or not, but I remember very clearly lying in bed in excruciating pain and my mom saying, this is migraine that you have, and them trying all sorts of different wives' tales to treat migraine.
Was there a period when you were having the attacks and you didn't know actually what was going on? Was it a mystery for you?
So, I mean, that's an interesting question. I don't remember that. It seems that in my memory from childhood, I always knew that it was migraine. My parents seemed to always know it was migraine. Of course, there could be earlier years when I just don't remember that. But at no time did I wonder, is this something different?
Mm-hmm. And you first saw any sort of practitioner when you were, so things started when you were 7 and you first saw a practitioner perhaps when you were?
I would say that I first saw a practitioner that I remember actually when I was in my teens. I may have seen a doctor when I was much younger, but I had a lot of health problems when I was younger in autoimmune conditions. And so I just don't remember ever seeing a doctor for migraine literally until I hit my mid-teens when the attacks became much more frequent.
And by that time, the sort of features that you had, they were one-sided or? What do you remember?
Yes, so a typical migraine attack for me was that the pain was very, very severe. It would escalate quickly. There was no way I'd be able to push through it. The pain would be one-sided. I couldn't tolerate light, sound, all the typical presentations for a migraine. It was throbbing, pounding. Honestly, it would feel like my head was going to explode. When I had one of these attacks, there was no way I was able to move about. I would have to go in my bedroom, close the curtains, be somewhere quiet, very, very dark, and just stay still. As the attacks became more frequent, there was a lot of sensitivity in my scalp, especially if I would touch my hair or pull my hair. If I was trying to brush my hair, the sensitivity was unusual.
So as well as the more typical things that you told us about that you have during an attack, I think you get some of the, I think what we're coming to now know is probably classical that we haven't really looked at, things like brain fog, concentration problems, or fatigue. Can you tell us a little bit about those things? They happen a little bit before the attack and with the attack, and how they affect you.
Sure. So for me, the earliest symptoms of an attack are actually generally nausea, which I know is very common, but also yawning. And that can be really embarrassing. If you're in front of someone, you're just yawning, can't control it. So, but for me, that's generally a sign that I have an attack that's on its way. I get a lot of neck pain, which can be tricky because the neck pain can also trigger the migraine attack.
Yes.
But the attack will almost inevitably cause neck pain and stiffness, and that in my upper shoulders too. I have trouble finding words when I'm in the middle of an attack. I may even sound like I'm drunk because I slur my words. Brain fog is really hard to deal with.
Yes.
So in the run up to the attack, and even, in the post-stroke as the attack is ending, it's still very hard to concentrate and think. And the fatigue is not just like being tired, it's just an overwhelming fatigue.
And the fatigue extends into the post-stroke, I think, as well.
Yes, the fatigue absolutely stays in the post-stroke. And generally for me, the longer an attack lasts, the longer that fatigue is going to last into the post-stroke as well.
So how long is your typical post-stroke? Because post-stroke is something we often don't talk about, but can be quite disabling. How long is yours?
Yeah, that's true. I would say that it really, again, depends on how long my attack is. So if I have an attack, I catch early and that stops quickly, within an hour or two or a few hours, then the post-stroke is very, very short. If I have an attack that I'm not able to stop quickly, that may last days, sometimes even weeks, the post-stroke can go for days and days. And sometimes it feels like it's almost going into the next attack. And so I don't have any break from it at all.
And I think you mentioned one more, shall we say, not typical thing that happens in the premonitory phase.
Yes, absolutely. So I used to get Alice in Wonderland syndrome. I actually haven't had it for the last couple of years, but I've had it most of my life, did not know what it was until the last few years. But for me, it would happen before the pain of the attack started. And if I was talking to someone, they would suddenly seem really, really tiny and far off. And it was a bizarre experience.
Yes.
Because I didn't know what it was, I actually thought that was normal. People all did this until I realized, no, that's not normal.
So you've had migraine for quite a while. Tell us a little bit about how it's progressed, the ups and downs.
Yes, I wish I could say that it just kind of progressed in a straight line or, suddenly got better. But for me, it's really gone in cycles. Generally, overall, over the decades, I would say it has got worse. The attacks have become more severe and they have lasted longer, more treatment resistant. But there have been times when I've been pretty functional and it's been really well under control. After my third child, after I stopped nursing, it felt like the migraine just went completely out of control. And I was even an inpatient at a headache center for 3 weeks at one point. Sometimes those treatments that I had seemed to work. Sometimes treatments helped for years. And then all of a sudden they'd either stop working or there would be intolerable side effects. And so dealing with it it's really a roller coaster. Every time I feel well, there's always in the back of my head, is this going to be a good patch? Is it going to be a long good patch? And when is it going to end? And I'm going to be back in basically migraine hell again. And so trying to deal with that roller coaster of the disease, knowing all the while that it's just gradually chronifying, getting worse, has definitely been a challenge.
So, when did you first see a headache doctor?
So I didn't see a headache specialist until I was about 24 years old. By that point, obviously I'd survived my childhood, my teens, I'd actually got through university, and I went to see a headache specialist in London. Very, very clear memories of that because it was a totally different experience than I'd expected.
How was it different?
I think for the first time, I was seeing a doctor who I felt understood migraine, that they could not only say, yes, you have migraine, but they were able to say, you need to be on preventive medication. This is what is going on. And this is a way to navigate this particular disease. Until then, anybody I'd seen, it just felt like they were just guessing.
Seeing the headache doctor sounds like it validated the problem that you'd had to some extent.
It definitely validated it, but I would say that it also gave me hope because by that time I was starting to lose hope.
So it seems to have taken a little while from when your attack started and Mum realised it and you saw various doctors until you saw a headache specialist. Well, why do you think it took so long?
I think part of it obviously is that we didn't have the internet back then. So if you had severe migraine attacks, there was really no way to know how many other people were having that or what to do about it. So everything involved a lot of different research. For myself, no one had ever suggested that I should go see a headache specialist. Honestly, as a child, I don't think they even existed. Maybe they did, Dr. Goadsby, you would know better than me. But yeah, the first time that I realized that was even an option was when I was in my mid-20s. Before that, I saw an osteopath, I saw an acupressure specialist, believe it or not,
yes.
And just general practitioners, and none of them knew how to manage migraine.
And the particular benefits of seeing a headache specialist when you eventually did come to one?
I would say that it was life-changing, not in so much as all of a sudden my migraine attacks stopped, or all of a sudden I got my life back, but all of a sudden I had hope because I felt like I was talking to someone who understood migraine. And part of the tough part of that was that, I moved away from England, moved to the US, and so I had to start all over. But each time I've seen a new doctor in the US, it's really been encouraging, because I've seen some of the best headache specialists, to put it bluntly. I've always advocated for myself. I've always tried to see who is going to be the best doctor who can help me. And the difference in seeing a certified headache specialist rather than a doctor who has no training in medication, no education, and not necessarily any deep interest in it, is literally night and day, with just the creativity, with the different treatment options, and the understanding that, yes, this is a really serious disease, and it's important to get it under control, because if you don't, it's going to chronify. It's just going to get worse.
How many days of any sort of headache do you have now, and how many severe days do you still have a month?
Sure. So I would say I have anywhere between 15 to 20 days of any kind of headache. In a really bad month, it will be daily. There's always some low level of pain there that I just kind of try to ignore. I would say for the bad days, that would be 10 to 15 a month. Those would be the days that I have to stop what I'm doing, or take medication, use a device. And it varies, obviously, from month to month. Some months are really bad, and some months are miraculously good.
Do you find the unpredictability of migraine and the relative unpredictability sometimes of the treatments part of the burden?
I would say that the unpredictability makes it really hard, because everything I do has a caveat to it. So it's always, yes, I can come, unless this happens, and I can stay unless this happens. So not being able to plan for when the attacks are going to come is very challenging. Although sometimes, obviously, I do know there's a high risk. If there are certain triggers that I know are likely to set off an attack, I'm not really sure if that makes it better or worse. If anything, it just kind of makes me anxious and kind of adds a fear factor to anything that I do.
Migraine's been a rather unhappy traveling companion for your life, from what we've discussed. What sort of things has migraine taken from you?
I would say that migraine has taken so much from me, to be honest. It's stolen my life and the dreams that I originally had, starting, even as a teen, when I wasn't able to listen to music like my friends were able to, or just wearing perfume, which seems kind of strange. That's a big deal, but it's all these little things that make a difference. In college, struggling to study, struggling to take exams. My first marriage impact was just huge, and my marriage did not survive it, partly because we had 3 young children. I was constantly in the emergency room, and always just fighting to be healthy with my children. I would say that's probably the biggest cost. I've lost time that I can never, ever get that back. In addition to the fact I have 3 sons, all of whom have migraine. So it wasn't only me struggling with migraine, but it was also them struggling with migraine too. I've lost friends. People don't understand chronic pain. They don't understand the unpredictability of migraine. In my social life, like I said before, everything is a caveat. It's always like pending how I feel. And then I'd say for my career, I've had to change my goals, my dreams, my hopes. I'm very, very happy in what I do now as a patient advocate. This has been a blessing, but everything in my life changed from what I originally had hoped it would be.
Have you felt stigmatized by migraine?
That's a great question. I would say yes. Stigma is really tough. I mean, even starting when I was in junior high and being told by a school nurse, you need to get outside in the fresh air, go for a nice walk. And so everything from that down to friends who do not understand, I think the hardest for me has been the healthcare system, really not understanding what migraine is like. Obviously, the exception being, a lot of headache specialists, but in general, just there's this stigma about going in and telling doctors, I'm sick all the time, I don't know how to stop the pain. And I'm always feeling like I need to convince them this is real, please believe me, this is real. And so living with that kind of stigma in the workplace, with your friends, with doctors, it's been a really big struggle. But a type of stigma that people often don't talk about is self-stigma. Mm-hmm. When I look at myself and I think, wow, this is my fault, or I should be doing better, or why am I in bed so much? Why am I struggling so much? And I think that's the saddest stigma of all. And so many people with migraine live with that.
So, Shoshana, you probably learnt a lot about migraine in your time. Is there advice you'd give to another person with the disorder, or even their family, to make their lives better?
Yes, absolutely. I think that it's really hard to live with a chronic disease that is unpredictable in when the exacerbations or attacks are going to happen. So for me, it's been really crucial to find ways to hold on to hope. That means for myself, looking out and seeing what other options are there, what is in the clinical pipeline, who would be the best doctor to see. But besides hope, it's also finding purpose in the pain. So that's why I love doing advocacy, and the people who I know who are thriving, even despite living with this disease, are people who have found that they can help others, even when they're in the midst of suffering themselves. I think I would tell people, don't give up. Whatever you do, do not give up. There is always hope. There's always something new coming down the line. And advocate for yourself, be empowered. If your doctor is not able to help you, go to another doctor, get a second opinion, connect with others who have migraine as well would be really crucial, because when you meet other people who are living the same type of life as you, that enables you to keep on going. It normalizes your disease, even though there's nothing normal about living with migraine. When you meet other people, it feels more normal, because you're not the only person. There are other people out there struggling too. And the tips and the help and just the connection will make all the difference in the world.
Thank you for sharing your story today.
Thank you for having me. I appreciate it.
We hope you enjoyed watching this video and have gained a better understanding of migraine. Please be sure to check out videos on other topics in this series.